So welcome to the Silverleafpms guest speaker series, where we bring you insightful and inspiring conversations with professionals across the healthcare industry. I'm Beverly, and today we're excited. So let me introduce you, and then you are a life coach at Behavioral Health Clinic. Thank you for joining us, and please just tell us a little bit about you.
Well, I've been a life coach for about 4 years. I've been with Behavioral Health Clinic for the last 6 months. And previously to life coaching, I've been a mental health counselor, adult mental health counselor for several years. I've worked with at-risk youth and juvenile offenders as a counselor, and I've just been in kind of the helping professions, behavioral health professions for about 12 years now. So
It's a long time. It's a long time to have done all of that.
Mhm.
So as a life coach, what is your educational background? Are you therapy? Are you
Um,
like where's your educational background come from, I guess?
I have a master's in psychology,
Okay.
and my bachelor's was actually in English literature.
Oh, wow.
I had a little rebellion in my in my youth. I just figured that, if I read books about people, then I would learn a lot more about the human behavior than maybe sitting through some of those sometimes excruciatingly boring classes. So I tried to marry two different passions, I think, there.
How did that work for you? Did it
It's
help?
working out. It's working out just fine. I don't regret it. So
I never would have thought about that, like
yeah.
studying English lit to learn more about people. I tried to take world lit in college and I was lost. I was like, drop this class. I don't know anything that there's a thing. But English literature was very interesting, and I wouldn't have never paired those together until you said that. So I think that's an interesting concept to do that. Um,
Yeah.
and so you doing life coaching now, and you said how long have you been in life coaching? 4 years? What you
About
said?
4 years. Yep.
4 years. And then previous to that, you were working with the youth foster care system, and children, adults, I guess, adolescents, type of thing. And what got you into life coaching?
I made a big move during the COVID era as well. Moved to a different state, which provided some challenges for licensure, just given kind of the nature of my degree. And I also had, I was staying at home at the time with my child, and I just really, um, yeah, it just kept coming up. People just kept telling me, "Have you thought about life coaching?" And I was like, "I don't even know what you mean, what you're talking about." And so there was a lot of talking to different life coaches and just kind of reaching out across the spectrum. And I eventually did attend a certification, life coaching through Professional Christian Coaching Institute, which is associated with International Coaching Federation. And so I got some certifications and just met a lot of coaches and learned a lot more about it and started to have a passion for, I think, the philosophy behind coaching, which we can talk about later. But yeah, so that's kind of how I got into it. It was like partially accidental. It gave me a lot of freedom to kind of to do it on my time at that moment. So yeah.
Isn't that funny how things kind of fall into place sometimes,
Yeah.
when you least expected it, when you went to school many years ago, life coaching wasn't even on the radar. And then that just
No.
kind of came into the mix and fit, and obviously you like it, or you still wouldn't be doing it 4 years later.
Yeah.
And all that. So, how long was your certification for life coaching?
It was about I think it was a year, so I could have continued, but I haven't yet. I may,
Yeah.
there's a lot of good information out there. I definitely felt like it was a good program. I got a lot from it.
Mhm.
But yeah, I was already working at the time. I was already coaching through that. And so it was just kind of an added benefit. It wasn't necessarily like something I was trying to do in order to start coaching. So
Right. Do you feel like you're using your therapy skills along with the life coaching? I know that you and I talked a little bit before we started on here and talked a little bit about how there is still such a stigma on going to see your therapist, versus if someone says, I'm going to see my life coach, I'm sure that you use some of the techniques that you were using in therapy in your life coaching because it's just going to be natural for you to use those things, right?
yeah.
Do you feel like it gives those patients a better, what's the word I'm looking for? They feel better about talking to their life coach versus, yes, I have to go see my therapist. How do you feel that patients respond to life coaching versus therapy?
I think they respond very well. I think there's some challenges there, mainly having to do with funding. So they can't use their insurance for
Yeah.
me. So it really is a self-led um, mode,
Journey.
I
Yeah.
guess you could say, mode of behavioral health. They have to really want it. They have to invest in it, which in my mind kind of solves a lot of the problems that I did have as a therapist, is that I felt like a lot of times people would just kind of get one because they could, or because someone told them they should, or their insurance covered it, and that they weren't invested. You know, it was
Right.
kind of like something that, or maybe they'd been doing it for so long, or they were doing it to get meds,
Mm-hmm.
whatever form that was. So there was a lot of frustration there for me. I mean, to answer your first question, absolutely, like having the experience in mental health counseling, behavior, all of my behavioral health and my education has been amazing, because really at the end of the day, we're working with human beings in behavioral health, and all the information is helpful. And all the experiences are enriching, good, bad, whatever. They help across the board. But yeah, I think coaching kind of, on some level, it solves a lot of my frustrations that I had in therapy, because I feel like people oftentimes come to coaching with kind of the motivation that I was always striving to kind of dig out of people, or like, you know, you
That
can
makes sense.
talk about your problems, or you can acknowledge your problems, but then there's this other factor of like, what do you want to do about it? What
Mm-hmm.
are you capable of doing about it? What's stopping you from doing something about it? And so there's this action piece with life coaching that feels really exciting. And it's been awesome to give to people, because yeah, I see so much success as a life coach, like real life success. And
Sure.
that's mostly because people are coming with that, I think, motivation in a sense, or desire to make change. So,
Right. I think you hit something, that's you hit something on the head there. Like I think therapy sometimes are like, oh, well, somebody told me I had a problem somewhere, or I think I have a problem. Can you solve my problem for me? And sometimes that problem takes looking inward and, where do I play a part in the problem? Right. So if someone comes to you and goes, I know the problem and I need you to help me, hold
yeah,
me accountable, cheer me on when I'm doing well,
yeah.
and guide me a little bit with this problem so that I can work through it. So I could definitely
Mhm.
see the difference there. And that's really cool. And I, like when you said, people coming to you motivated, that makes a big difference in any kind of medicine
Yes,
that you're,
yeah, for sure.
no different than being a diabetic, right? And I go see my primary care doctor. If I'm still eating all the stuff that I ate before and my sugars are still crazy high, and I have acknowledged that I actually have diabetes and I need to take care of myself. And
Yeah,
I this problem versus just going to my doctor going, yeah, I need my next prescription of my insulin or whatever, but just still keep doing the same thing. I think the provider, even if that situation where the patient comes in going, hey, my A1C is this, I've been watching my sugars, and you're really on top of it and you're wanting someone to guide you through that journey, is a whole different situation than, trying to pull somebody along when they really don't want to be there. I guess that'd be
absolutely.
kind of
Yeah.
thing. So, in the last few years, technology has kind of shown us how important it is in the systems in healthcare. How has telehealth and modern systems influenced the way that you deliver care?
Huge. I mean, I wouldn't work for behavioral health clinic in Wisconsin, being from South Dakota right
Yeah,
now, if it weren't for that. Yeah, I'm very grateful. I have clients all over. I've had clients international clients. I've worked with, military people that are in different countries, and there's a lot of need for them to have support as well, across those barriers. I mean, it's really stressful
yeah,
to be stationed in a different country and a culture and that sort of thing. And so I've seen that it's made possible a lot of really awesome things, it's been very convenient. I'm pretty biased on some level towards in-person care because of that
Mm,
relational piece, because, um, and I think it kind of depends on the person and where they're at. But I think a lot of people, particularly who are struggling maybe with social things like, anxiety, for example, or even depression, like you can't replace that connection. You cannot replace sitting across from another living, breathing human being and
absolutely.
having a conversation. And so I think that as long as we can recognize that with people in the mental health care and not gloss it over and not try to be like, well, it's just so great though, isn't it? Then we're gonna get more benefits from both modalities. My hope is that we never stop seeing clients face to face if we can, right? And maybe even getting better at picking and choosing like who really needs to that opportunity or that motivation to
Mm,
be in person with someone. And then recognizing that, man, some people, I mean, they'd never do something like this if it wasn't for telehealth, so that's great too. So yeah, I think they're both wonderful and for different reasons.
yeah, I agree. I mean, I think COVID opened up a whole world, this whole telehealth world, which was great when we needed it. But my friend has a practice, and he was saying that he's noticed that some of the older generation wants to come back into the office because they, one may be living at home alone, they don't have much of a social life really, and they want that one-on-one, and it's from their, from I don't know, probably 40 back, older. They were grew up and stuff going and seeing patient or providers in the office, and so that's what they're comfortable with. So moving them to technology made them a little uncomfortable, hard to connect, that kind of thing. And the younger generation, right, that is like tech savvy and all that, but they also need, I think humans as a whole need
Yeah.
face-to-face connection with people that you just can't get on, telehealth. But we live in a video oriented society, right? So we're doing reels, and we're TikTok and all of that, where we're seeing people every day online, but it removes that physical presence. And especially with mental health, when you're trying to seek that comfort in someone helping you through maybe some difficult times, I think really
Yeah.
in office, having that ability at least to be seen in office, maybe you don't stay in office all the time, but having that connection where, if you need comforted, you can reach out to someone, you can touch them
Yeah.
in their hand or whatever, hey, I'm with you, or whatever they need. Very
Yeah.
different from telehealth. But then you have the people, like you mentioned, that may have some social anxiety or agoraphobia or something like that, that they just are so depressed that they can't, they're doing good to get out
Yeah,
of
and
bed.
maybe telehealth is that starting point, but I mean, even just, the amount of challenges in a sense, like even just getting to an office appointment,
Mm-hmm.
you have to get up, you have to get
Yeah.
dressed, you have to get there, and you have to show up, and that can be a huge success for where a lot of people are, and it can feel really good, and so yeah, it's
Yeah. I
definitely
think,
a both and. Yeah.
yeah, that's awesome. It can definitely be a game changer for a lot of people. So we've noticed that, different systems like in software and things like that, really kind of our backbone of healthcare now. Do you have any specific systems and things that you use there at your practice there at Behavioral Health Clinic that you feel like really make a difference in your patient care that maybe you have never used before?
Well, I wouldn't I've only really when I first came on with and I guess I don't know what you mean by systems. Are you talking about like
EHRs,
charting
phones,
or
yeah, any kind of software systems that you use, or even hardware type of stuff. Like, hey, I just started using a tablet this time, and it's really great. I've never used a tablet before. Or hey, this is a different system that I've EHR system that we use, and I really like this. And if you say no, there's nothing really that stands out. That's perfectly fine too. Just any
yeah.
technological stuff that maybe you're using or is different than you've used before that sticks out that helps make your job easier.
Well, the question doesn't apply to me too much because I'm contracted through the clinic and I don't have the same as being a life coach, I don't have to document the same way that like a clinical social worker or a
Right.
counselor has to. And so I kind of go back to my old fashioned roots, and I love note taking. I just take notes upon notes. And so I have stacks of notebooks and and
That
people's folders if they want it. And so yeah, I don't do a lot with that right now. I have
Yeah.
appreciated different systems in the past when I've worked for clinics in that way, but I couldn't tell you what their names are either.
Oh,
So
that's perfectly fine. I tried to make the move recently from spiral notebooks to Remarkable. Have you ever heard of Remarkable? It's like the write it feels like a tablet when you're writing on it, and it's
yeah.
great. However, I put it in my drawer. I still like my paper because
Mhm.
with the Remarkable, I have to put it in folders. I have to keep things organized and find things and name stuff, and
Yeah.
I can't just flip the page and start writing again. And
Yeah.
it's frustrating because I spent all that money on the
Yeah.
Remarkable. Like I don't like it. I like using paper. I guess I'm old school.
Yeah.
I could just flip through and find my notes. So anyway, it's kind of funny how people go back to old things that they're just used
It
to using.
makes me feel connected to have a pen in my hand and just
Yeah,
taking notes and yeah.
yeah, because everybody's got their favorite pens, right? The
Yeah.
ones that I like ballpoint, whatever whatever
Yeah,
brand
yeah.
pens or whatever
God
paper and
forbid
stuff.
you steal my favorite pen.
Yeah, I love office supplies. That's the thing. So every professional faces challenges. What would you say some of the biggest hurdles that you've encountered as a life coach, and how do you overcome those?
I think as a life coach, one of the bigger challenges, and maybe it's working itself out, but is the credibility of life coaching.
Yeah,
Um, anybody can be a life coach, pretty much anybody can say that they are a life coach. They don't have to have any education. There really isn't any type of, certification can help, but it's not necessary.
right.
And so I feel like I've had to defend in a sense, like the legitimacy, I guess, of life coaching and why it's helpful and why it's kind of a real thing and how there is a lot of thought behind it and even how it's separated in a sense from counseling or therapy or whatever. Um, and that can be challenging, because I don't want to disparage one form or the other. And I also want to have great examples of life coaching, of being like, hey, this is what that is. But it's kind of an uncharted territory right now. Again, it seems hopeful. It seems like a lot of good things are happening. It seems like a lot of psychologists or counselors are either doing both or moving into coaching for whatever reason. And so that may be one of the challenges.
Mhm.
And, kind of, I guess the way that I've seen it is like, how do I make, how do we help people believe, right, or understand that this can be beneficial to them in
Mhm.
multiple circumstances? I think a lot of people think, oh, if I have a problem or something bad is happening, I have to go to therapy. And I think there's some overlaps there,
Mhm.
it
I
depending
agree.
on where you are, you could get great help in your marriage. Your marriage could be greatly improved through coaching, versus this other thing. And so it's just kind of about getting it out there and helping people understand the differences. That can be challenging.
Yeah, I
And
think,
then
yeah, for sure.
yeah. And then I would say the second one, um, I think it's a challenge, but I also think it's helpful in a certain way. But the insurance not covering life coaching and not falling into any type of healthcare category right now. I mean, if people have health savings accounts, they can build their health savings accounts for
Mhm.
for coaching. But it's not necessarily healthcare. But that also has the benefit, like we just talked about, of people choosing this for themselves
Mhm.
and not choosing it out of a place of like, I don't know, even a place of pity or need or whatever, but just a real choice. You know what? I'm gonna try this and I'm gonna pay for it and I'm gonna invest in it and I'm gonna
Yeah.
see what I get out of it. And that tends to have a huge, I just feel like the success rate that I
Mhm.
see as a coach is so different in a sense.
Right.
And that could obviously be just, the type of clients that come to me. I get a lot of referrals and things like that. And so, yeah.
I think of life coaching kind of like, or similar possibly to having a gym trainer, right? A
Mhm.
personal trainer that is holding you accountable. They're going to show
Right.
up with you. You're going to put the work in, and they're going to show up there with you. They're cheering you on. They're giving you guidance and things like that.
Mhm.
For your
Mhm.
cheerleader leader, but also your critic, and
Yeah.
kind of bringing things forward for you to do. But totally different experience than if you show up to the gym by yourself. And there's no
Yep.
one there to motivate you, telling you how to use the equipment or whatever, or cheering you on, doing a good job, five more, go five more. I kind of look at it like that, where
Yeah.
having someone, I feel like it's kind of like having somebody as your personal cheerleader, right? That you're there for someone to talk to about issues that they may be having, but also search for those solutions, and then cheer me on or guide me back in the right direction, when I need that. But you're really helping me grow as a person
Yeah.
versus therapy, where I'm bringing a problem to you, and you're,
Yeah.
trying to help me with this problem, when the problem may be me, but it may be
Yeah.
other things too. So
Mhm.
there is a difference there. And I think it's great when you join the two together, right? Someone that's got the therapy background and now they're being a life coach. They bring both of those things into the mix together. And I think it's kind of a 2-for-1 type of deal there. So I think that's
Mhm.
great. Maybe when people are looking for a life coach, they look for someone that has that therapy background as well, instead of just
Yeah.
somebody that decided one day they were going to be a life coach. So, I mean,
Right.
they might be a great life coach, not saying they're not, but I think
Yeah.
that might benefit there if you find someone that also has that therapy background, and like, just be willing to pay for it. I think people also value things that they pay for sometimes too.
Yeah,
Um,
for sure.
so they're gonna I'm paying her however much, $200. I'm not saying that's your rate. I'm just saying,
Yeah.
paying this person $200 a visit. I'm going to show up and I'm going to do what I need to be doing because it's worth something to me. So,
Yeah.
this is my. So, let's see where do you see life coaching fitting into the bigger picture of healthcare today? This can kind of combine with the next question, as far as like beyond the clinic where you are, life coaching is, evolving and it's becoming a thing. We talked about a little bit about that earlier. How do you see yourself as a bigger picture, whether that be in general healthcare as a coach or in your current spot there? I mean, you work in a clinic with a lot of other providers. Tell the folks listening, like, how does your role impact your current place, and where do you see coaching going in the future?
Hmm. Yeah. That's a great question. I think just like immediately I start to think about like holistic healthcare,
Mm-hmm.
and just kind of this idea of not just doing not just addressing the problem, but like kind of a preventative measure in a sense, or an anticipatory type of healthcare, where like people sometimes they're like, oh, I'm gonna take my vitamins, right? Because I know that my body needs these type of vitamins, right? And
Right.
that's a form of healthcare that's different than getting to a place where you're like, I gotta have these vitamins or my liver's gonna fail, right?
Right.
Right. And so I see coaching and here locally where I'm at, I also work with other providers, and I do specifically work with holistic healthcare providers because they seem to see the benefit of it
Yeah. Yeah.
very, very easily, and they can recommend, they have people come in and say, oh, I've got this going on, and they might just say like, hey, have you thought about, some coaching to help you just through this period. So it's kind of like spot care in a sense.
Right.
And I think and then as far as behavioral health clinic, what I'm really hoping too, because I feel like therapy, some people can get really bogged down in therapy and it can become something that they need or they think they need, or they get really highly dependent on. And so there can be kind of a flat line there. And
I didn't
so
think about
I'm
that.
hoping as a coach for that clinic that, when people get to a place where they say, you know what, you're doing so much better. Like I've watched you grow, you're managing certain things this way. What do you think about a coach, right? To help you move in this, whatever their treatment goals are, right? To
Right.
to kind of take that next step. And so that's kind of where I hope to be, is I hope that that I can kind of come in and bring people to that next step. Maybe that have had a long journey in the process, behavioral health process, or, I even, I have clients here that that, they see a therapist or they're on certain meds or they have some pretty severe diagnoses, but
Mhm.
they see me to live with those diagnoses and to
Yeah.
actually feel like their life is worth something. And, they, and to make progress, like how can I, right? What kinds of jobs can I do when I'm dealing with this, right? Where can
Mhm.
I start? How can I get there? Or, how do I kind of structure my life in a way that is more fulfilling for me, right? So we're not necessarily working on their diagnosis. We're working on what their life looks like with this diagnosis and where can it go?
Yeah,
And
kind of
see
adjunctive treatment.
huge,
Yeah.
huge improvements, with just people that that think, or even their providers think like they're not going to have this level, they're never going to be able to do this or that. And it's like, I don't really believe that, as a coach, I don't really believe that, I think maybe I'm a coach because I believe in people's potential to get stuff done under really
Right.
crazy circumstances, and that it
Oh,
actually
100%.
makes us feel good to do that.
I think never, because we put enough self-doubt on ourselves, right? Like, oh, we can't do it. And then you have someone telling you you can't do something, it makes you feel like you really can. So if you have someone, that's cheering you on and talking to you through things and motivating you even more to get to a life that you want to have, I could see where that would be very beneficial, and how some people could overcome that self-doubt and what other people have told them, and limiting their own lives, and just having that person there to hold their hand through it. So for other people that are thinking about having life coach, you're thinking about doing life coaching as a career path, or that those that are already in it or maybe have just started it, what advice would you give them?
I think it's helpful to maybe to have kind of a niche, or to start there at least, right?
Mm-hmm.
To kind of find out what your passion is, where you feel like you want to coach people to. Like, for example, I mean, there's all sorts of coaches, right? There's financial coaches or whatever. Life coaching is more like it's about the the individual person, but also like, what do you mean by that? Right. So I think
Yeah.
a coach kind of has to, in order for them to be valued or to be valuable, they have to be promising something kind of, or at least focusing on something. So for example, for me, I focus on character development, really, ultimately. I focus kind of on like, okay, we all have a vision or a version of ourselves that we want to be, right?
Mm-hmm.
And that can be from a moral standpoint, right? There can be, we want to be more patient. We want to be this, we want to be that, right? We want to be more disciplined or something. Okay, that's part of that is your character. And when we are striving for or even achieving certain aspects of that, when we are representing the person that we want to be, that is an amazing thing. It brings
Mm-hmm.
a lot of flourishing to someone's life and a lot of happiness. Since when you can really honestly look at yourself in the mirror and say, hey, I'm the person I want to be, or I'm at least trying to be the person I want to be, right? And really understanding that. And so that's kind of my niche. That's how people know about me. I feel like when I'm successful with someone, that's kind of what they're going to bring to somebody else.
Oh,
It's
for
like,
sure.
you know
Yeah.
what? They really helped me to like get to this point. And so maybe that's fitness coaching. Maybe that's like how, eating healthy, that has huge implications for your life.
Mm-hmm.
So I feel like life coaching, just find what you're good at, what you're passionate about, and offer that to people with some type of authority and belief and passion that you have something that you can that is valuable,
Yeah.
to somebody
Yeah, because
else.
it's kind of like, you know, I hate to say selling yourself because it is sort of, but you have to let people know that, hey, I know what I'm doing. I'm gonna help you with this because this is what I do, right? it would make somebody feel very good if they join you and you're like, yeah, how can I help you? You know, you're not really passionate about anything, and you're not guiding the journey with the patient, you know, and helping them through things. But having that niche, then I know what I'm coming to you for. It's not just a generic, you know, well, tell me what you do and how can you help me type of thing. I know
Yeah.
that I'm coming to you to help build a character, not flaw, but something in me that I want to see different. So yeah, I can see where
Mhm.
the niche would be very helpful there. So you
Mhm.
mentioned earlier, we talked a little bit earlier about how important different systems are and stuff. And I know Silverleaf has played a role in supporting your clinic. How have we supported you guys there at Behavioral Health Clinic?
Well, I mean, without being, I guess, maybe more of an authority in that area, I would say that it probably companies like yours have been the reason why they're even endeavoring to create a coaching arm, right? Because there's a
Mhm.
lot of just what we've talked about, a lot of creating legitimacy around it, a lot of marketing it, and like letting people know that it's even there, right? That it's a resource that they can go to their local behavioral health clinic and find this
Mhm.
resource. Um, and so yeah, that's huge. I don't think that if they probably wouldn't have taken such a risk if they didn't have, places like or, people like you to help get that kind of out there.
Yeah.
And so yeah.
Yeah, because I don't think just the normal person out there, I don't know if they associate life coaching with mental health really.
No.
You know, it's kind of like a therapy, right? They think of therapy and they think of med management and a psychiatrist or a psychiatric nurse practitioner, but they don't really think of life coaching being part of that. So I think it's great that Behavioral Health Clinic has pulled life coaching into the whole, you know, mental health care plan there. And
Mhm.
I think it's really interesting when I see people pull in other alternative stuff too, you know, in treating the body as a whole, as well, you know, so whether that's yoga or meditation or, you know, Reiki, whatever it is, pulling all of those extra things in so that it's not so stigmatized, right? That taking care of your mental health this day and age, for sure, is not stigmatized. That people should be comfortable in whatever phase they want to go into, and just use it as a self care type of thing, right? I think we all
Yeah.
could probably use a little health life coaching. You know, even if you just make one visit and just see what it's all about, and see
Mhm.
if that's something that could benefit you or not. If it doesn't, no harm, no foul, right? Like you might have
Yeah.
spent the money, but at least talking to someone to say, hey, I think I could improve on this. Can you help me with that? And just kind of get some, and then they don't feel so intimidated, right? Like they
Yeah.
don't like, well, do I need therapy? What do I need? Start with a life coach and just see. So,
Mhm.
um,
Yeah.
so yeah, let's go on this. So let's pivot just a little bit. I want to talk about more of your patient experience. So, is there any, you know, one or two even memorable patient stories that you have that at the end of that visit or the end of the, you know, journey with that patient, even that you're like, wow, I really impacted that person. I can really tell that I made a difference in that person's life and getting them to where they are, or maybe where patient has told you you made a difference. Do you have anything that you could share with our audience like that? One or two stories, short ones, no patient information, obviously.
Yeah. Yeah. Question. That always feels good to go back and just look at some of those situations. I can think of two probably right off the top of my head. Um, One of them is has been a long time client and has come from a kind of a more complicated background of mental health issues and certain diagnoses and so when I first started working with this person um they were pretty low functioning, not really able to hold a job, really depressed, just really afraid, just wondering, just really wondering what their life could be like given kind of the dump
Mhm.
that the things that had been dumped, right? um and now, I still meet with this person regularly, but I see it so much more as like, tell me what's going on in your life,
Mhm.
like it's exciting. It's kind of like meeting a friend after a week, right? And just like continuously being so overjoyed and also kind of incredulous at what this individual has been able to accomplish given the challenges that they have.
Mhm.
And the perseverance, just the straight up like grit of character that I've witnessed, it's amazing. And I get to tell that to them. I get to point out that change. I get to say, like, do you remember when, and now here you are and you're talking about getting a degree and you have a full-time job and you're making a difference, and yeah, you're still struggling with some of these things, but you couldn't be more worlds apart from where you were. So that's one that gives me joy every week. um, and then I've had other experiences with people. One I can think of where again, a long history of seeing therapists,
Mhm.
and not bad experiences, really valuing therapy. And they happen to be connected with another client that I had that makes recommendations. And they told that client, I feel like I've experienced more growth in a month of seeing this person than I have in years of therapy, in the last several years of therapy. And so, to be able to ask that question, like, why do you feel like that? Like, what would make you say that? I'm not waving a magic wand here. This is not, it's not what's happening, right? But to have them answer, because you push me, because you've pushed into all of these areas in a sense. And I do feel like as a coach, you get a little bit of freedom to do that. You at least can say, like, hey, what if you pushed right there? Right? Like, I'm not doing it for them, but I could say,
Mhm.
like, what if you just went a little deeper right there?
Mhm.
And that can be this huge freeing experience for people who do feel like they're kind of stuck with something, a diagnosis or a particular just a habit, and so yeah, there's just been so much, and it helps me. Um, there's so much that I get from it as well, just the exposure to people's lives and challenges and the things that they go through, and when they figure it out, it's like, thank you. You just helped
Mhm.
me figure something out, or just those kind of
Aha moments.
client led
Yeah.
aspect of things can just be really inspiring. So.
Yeah, I think that, I mean, stories like that really highlight the power of what you do for people. And I think sometimes as a person, we may not always see that growth. Someone from the outside looking in at us from the first moment, and they don't really have when you meet these clients for the first time, you haven't known them their whole life. I've known myself my whole life. So the
Mhm.
the the characteristics that I have or the habits that I have or whatever aren't new to me. I've always been doing this. So to have someone from the outside looking in and seeing those differences, right, and noticing those differences and calling that back to my attention, I think is powerful, because I may not have seen it that way, and I've
Yeah.
talked to a couple of life coaches over my period of being an entrepreneur, and you don't, when you're in the thick of things and you've got your head down and you're just working, 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 it helps to have someone on your side, because your family may not be on your side supporting you as far as being an entrepreneur or whatever. But if you have some stranger, right, that now I've met and you've kind of become sort of a friend, right? I kind of think of life coaches as your friend, because you don't feel like it's really that heavy healthcare provider. I'm not prescribing
Yeah,
medical.
that power dynamic isn't quite
Yeah,
there
it's a
yet.
little different, and so then you're able to go, hey, Bev, did you remember like 2 months ago when you were sitting here talking about this, and you've made a couple of these changes and now you're here? And then I
Yeah.
go, oh, I didn't think
Yeah.
about that.
Yeah.
That's different. Yeah, you're right. You saw it. Couldn't even see it on myself. Right.
Yeah.
So I may see little things, but I think having someone validate you like that, and you're in
Mhm.
my corner, and you're rah-rahing and being my cheerleader over here and pushing me to do things that will make big changes. I think that's huge. Just
Yeah, that reminds me of just one more thing, that
yeah,
just
sure.
when it comes to client appreciating kind of these experiences. But one thing that happens, I feel like you're not super willing to share your therapist, but you're pretty willing to share your life coach.
Yeah.
And there's nothing that feels better in a sense than working with someone and having them be like, "Oh my gosh, you should call my life coach. Like, here's this problem, right, that they share, and they're willing to say, like, I know someone who can help you with that."
Hmm.
And so I've had so many people, I've worked with entire families. I'll start working with someone and they'll be like, "Oh, my husband's got to talk to you."
Oh,
Right.
yeah.
And then I work with them, and it's different than therapy in a sense because I am working with the whole situation,
Yeah.
and there's not as, it's not as, I'm not saying there's not confidentiality involved. Obviously there is, but in a sense, it's like you're working with the problem that everybody's dealing with. And so there's not so much of a stigma of like, oh, you shouldn't work with them or you can't, and so
Mhm.
that's just been super rewarding, is to just have those constant referrals of that are coming from people who felt like they got something.
Yeah, 100%. And again, going back to that stigma, right? If
Yeah.
I tell somebody about my therapist, then I'm acknowledging I'm in therapy. And
Yeah.
therapy has a negative, I mean, hey, we don't like it to, it shouldn't, but it does.
Hmm.
When I tell someone
Hmm.
I'm going to see a therapist, then I feel bad because I'm like, oh, or they
Yeah.
perceive me as a certain way, or she's crazy, she's
Hmm.
got problems or whatever. But
Hmm.
if I say, hey, come see my life coach, I don't think of it that way. But
Yeah.
they both can be helpful,
Yeah.
So anyway, so I want to thank you so much for sharing all these insights with us and your experiences and everything today. It's been a pleasure having you on the show. Was there
Mhm.
anything else that you want to share with anybody as kind of parting words, or you think we covered everything?
No, maybe I would just say, like, I really hope to see life coaching just reach its full potential and, be taken seriously both by the public, but ultimately it comes from coaches.
Yeah.
We have to do this in a genuine, responsible, ethical way, and it can't just be kind of a way to make money, but really like why,
Art. Yeah.
how does this help people? Like, there's a lot of people who just need need to navigate some of these challenges that we're going through, and so this is a huge opportunity for the helping professions, and I encourage people who are interested to figure it out.
Coach, tell the audience where you're located, Petrina. So if somebody's listening and they're like, oh, I want to talk to her. Where are you located so that they can
I'm in
kind of
Rapid City, South Dakota.
South
Yep.
Dakota? Okay.
And my personal, I own a practice called Core Coaching and Psychology.
Okay. All right.
Mhm.
Well, again, thank you so much for coming on the show. We appreciate all of your insights and everything. And thanks to our audience for joining us today for this episode of SLPMS, Silverleafpms stories from the field. Be sure to subscribe to us so you don't miss other inspiring stories about the healthcare world. And until next time, thanks, Petrina. Have a great
Thank you
day.
so much, Beverly.
Here. Bye bye.
All right, take care. Bye.